Assalamu alaikum. Today in this video, let us discuss about what is hypokalemia, what is hyperkalemia, and the drugs which induce hypokalemia and the hyperkalemia. Firstly, let us see what is potassium, their functions and the normal ranges in our physiological system. Electrolytes like potassium are the minerals that circulate throughout your body, maintaining the overall balance of the fluid in your bloodstream and the cells, and helping with the electrical conduction required for muscle contractions, including heart muscle contractions and nerve functioning. Major electrolytes in our body includes sodium, calcium, and the potassium. Normal range of serum potassium in our body is 3.5 to 5 milliequivalent per liter. Now let us see what is hypokalemia. Hypokalemia is generally defined as a serum potassium level of less than 3.5 milliequivalent per liter. Moderate hypokalemia is a serum level of 2.5 to 3 milliequivalent per liter, and severe hypokalemia is a level of less than 2.5 milliequivalent per liter. Hypokalemia is one of the most common electrolyte disorders seen in both inpatient and outpatient care. It is common among older adults, and increasing age is associated with a marked increase in the incidence of hypokalemia. In fact, compared with young adults, an 80-year-old has more than triple the risk of having a lower potassium level. Hypokalemia may result from inadequate potassium intake, increased potassium excretion, or a shift of potassium from the extracellular to the intracellular space. Increased excretion is the most common mechanism. Poor intake or an intracellular shift by itself is a distinctly uncommon cause, but several causes often are present simultaneously. The symptoms of hypokalemia are nonspecific and predominantly are related to muscle or cardiac functions. Complaints may include the following: muscle weakness that begins in the lower extremities and moves to the trunk and upper extremities, decreased appetite and nausea, muscle cramps and pain, worsening diabetes control or polyuria, palpitations, psychological symptoms, for example, psychosis, delirium, hallucination, and depression. It also causes heart arrhythmias. It's hard to say how low your potassium has to contribute to heart arrhythmias. Generally speaking, potassium levels lower than 3 milliequivalent per liter put you at a much greater risk. Now see what medications can lower the potassium levels. Firstly, diuretics. In diuretics, furosemide, bumetanide, hydrochlorothiazide, and chlorthalidone are the main medication-related cause of low potassium levels. These medications are commonly used to treat high blood pressure, heart failure, and lower extremity swelling. Potassium follows water out of your kidney to your bladder, so diuretics which increase urination may lower your potassium levels. Coped medications. Sympathomimetic drugs such as beta-adrenergic bronchodilators cause a shift of potassium from the serum into the cell, thereby lowering serum potassium levels. The effect is potent, with the single nebulized albuterol treatment lowering potassium level by 0.2 to 0.4 millimole or milliequivalent per liter. Albuterol, theophylline, and steroids are the bronchodilators. They cause hypokalemia. Antimicrobials. Antibiotics such as penicillin, ampicillin, neficillin, and carbonicillin in high doses can induce renal potassium excretions. Such effects can occur with aminoglycoside therapy and amphotericin B also. Insulin. At high doses, insulin may lower potassium levels in the body by shifting potassium from your bloodstream into your cells. Next one is pseudoephedrine, which is available over the counter as a decongestant. It also pushes potassium out of your bloodstream and into your cells. Laxatives and enemas. Large doses of laxatives and enemas, particularly phenolphthalein laxative and sodium polystyrene sulfonate, can cause loss of potassium into the stool. It's worse if they cause diarrhea. Risperidone are the antipsychotic medications that may cause hypokalemia, but it's rare complications. Now let us see what is hyperkalemia. Hyperkalemia is defined as a serum potassium concentration greater than approximately 5 to 5 milliequivalent per liter in adults. The range in infants and the children is age dependent. Level higher than 7 milliequivalent per liter can lead to significant hemodynamic and neurologic consequences, whereas level exceeding 8.5 milliequivalent per liter can cause respiratory paralysis or cardiac arrest and can quickly be fatal. Weakness and fatigue are the most common complaints. Occasionally, patients may report the following: frank muscle paralysis, dyspnea, palpitations, chest pain, nausea or vomiting, paresthesia. Now let us see what the medications can cause raised potassium levels. ARBs, which is angiotensin II receptor blockers. ARB medications include losartan, telmisartan, valsartan, and irbesartan may raise your potassium levels. These medications are used to treat high blood pressure but can cause your kidney to retain potassium instead of letting it flow out with your urine. ACE inhibitors, which is angiotensin converting enzyme inhibitors. ACE inhibitors like lisinopril, enalapril, and quinapril also cause hyperkalemia like ARBs. Spironolactone. Spironolactone is also known as potassium-sparing diuretics. Like ARB, it can also cause the kidney to hold into potassium instead of letting it leave your body through the urine. Spironolactone is prescribed for cirrhosis, PCOS such as polycystic ovary syndrome and the heart failure. Next one is NSAIDs, non-steroidal anti-inflammatory drugs. NSAIDs like ibuprofen, naproxen may also raise potassium level by causing the kidney to hold onto the potassium. Cyclosporin and tacrolimus. Cyclosporin and tacrolimus are used in organ transplant patients to prevent rejection-related complications. High potassium levels commonly occur in patients treated with these kinds of drugs. Heparin. Heparin is a blood thinner given intravenously for blood clots or a heart attack, and it may also raise your potassium levels. Propranolol and labetalol. Propranolol and labetalol are the beta blockers medications that may bump your potassium a bit but not significantly. Beta blockers block your cells from taking in potassium from your bloodstream, causing your blood potassium levels to be higher. This, however, does not occur with atenolol, which is another beta blockers. Trimethoprim. Trimethoprim decreases urinary excretion of the potassium. Trimethoprim do not combine with ACE inhibitors, angiotensin receptor blockers, and the spironolactone. Hyperkalemia may have higher risk in patients with age greater than 65 years, renal insufficiency, diabetes mellitus, and the heart failure. Important to note: ARBs and ACE inhibitors exist in many combination pills with hydrochlorothiazide like lisinopril hydrochlorothiazide and valsartan hydrochlorothiazides. These kinds of combo pills have one medications that raise potassium level and other that lowers it, ultimately resulting in normalized the potassium levels. This medication come with the low risk of causing potassium abnormalities. So this is all about the hypokalemia and the hyperkalemia and the medication which induce hypokalemia and the hyperkalemia.